So what do we do? What's plan B? I think that one of the things that's important in terms of the opioid use issue is making sure, number one, that we don't swing with the pendulum too far to one extreme versus the other. And I think it's a great opportunity to recognize that there's a wide range of other non-pharmacologic interventions that are available to help patients living with pain. I think a mistake that we may make is if we just try to focus on the next molecule, we're missing sight or losing sight of the bigger picture, the context in which the pain is occurring, looking at the whole person and all the other factors that can be contributing to their pain condition itself. Well, again, I think that's when we need to look at not necessarily just the cost, but what are the benefits, what are the outcomes, so what does the research show us in terms of improving the meaningful indicators of what we're trying to do with our patients. Especially with chronic pain, that's much more than just pain control or pain levels. It's more about the quality of life. Is a person able to function? So many of our patients tell us that I'll live with a certain amount of pain, but I just want to have my life back. And so if we can focus on those types of outcomes and look at those rather than the outright cost of an actual drug, but what's actually making the difference, that's what's more important to focus on. I think it's somewhat of a double-edged sword. I think that just focusing on pain levels, looking at a pain number, which is how it's usually gauged right now, that provides very limited information. A pain number itself is so subjective. If two people wake up and say that they have a 6 out of 10 pain, and if for one person that means I'm able to do my regular day's activity, but I can't do any leisure activities. For another person with that same level of pain, they say I can't do anything today. That number, that value of 6 has just lost any value. And so it's more about what a person can do. So I think by eliminating that numeric system, it allows us not to be constrained by just a number. It gives us the potential to have more information about a person's functioning. But I think the flip side of that is if we're not paying attention to pain at all, then it could be something that ends up getting overlooked. So there could be unintended consequences. And so I think it's ideal to have something in the middle.